Early in February, Venerable Children asked me to send some pictures to our friends in Singapore and my parents. And my mom replied to me in Chinese. February 8th, 2020, Singapore. During this time of emergency, our entire family is healthy and well. Do you remember? During SARS in 2003, you were in the US. I was in college. Now with the new coronavirus, you are also in the US, exclamation mark. So you have never experienced what it is like to be in Singapore during a viral outbreak. In schools, every student has to take their own temperature. Morning assembly is held inside classrooms. Usually 1,000 students would gather in a parade square. And recess times are staggered. Everybody is diligently washing their hands. But the government says there's no need for us to wear masks if we are healthy. Every family can receive 4 free masks. So my mom put an emoticon there with sad eyes wearing a big mask. But the government says only to wear masks when we're sick and have to see a doctor, because these masks have to be used sparingly. We have to save them for healthcare workers on the front lines and those who really need them. So when we go out, all of us don't wear masks. Now there is another phenomenon of panic buying at the supermarkets, because people are starting to stock up on daily necessities, especially toilet paper. You must find that very strange. Singaporeans are so afraid to lose out. So because we're still in retreat, I haven't replied to her, but I will do so now. March 17th, 2020, Newport, Washington. Dear Mom and everyone else in the family, I'm glad you are all safe and well. Here at Sravasti Abbey, we are also doing well. Very kind volunteers continue to bring us food. People from around the world write to us asking if we need anything. We are so grateful. We're still in retreat, so every day looks the same. But outside, everything has changed. The new coronavirus, COVID-19, is here in America. Americans are also panic buying at the supermarkets, so it's not just Singaporeans who are afraid to lose out. But unlike in Singapore, where you have lived through SARS, all this is happening here for the first time. Nobody really knows what to do. Now, forget about free face masks. There are not enough test kits for people who need them. I read an article published on March 14th by NPR by an emergency room doctor in Massachusetts. He had a middle-aged patient who just returned from a country with known cases of the virus, and she had fever, cough, and shortness of breath. She also had HIV. So he requested permission to test her, and it was denied. So with a shortage of test kits in his state, they are now reserved only for people who have traveled to endemic areas, who had contact with a confirmed case, or who have severe symptoms that require hospitalization. And this doctor said many other ER doctors have reported similar stories. So the doctor could only discharge his patient, ask her to self-quarantine, and to return if she gets worse. And so because they can't get tested, many Americans are very worried that they might be spreading the virus to their loved ones or to vulnerable people. And even if they can get tested, they may not be able to afford treatment. So Dr. Paul Farmer, one of my heroes who specializes in treating infectious diseases in impoverished countries, he said in an interview he was struck by an early study of 138 patients in Wuhan, China, which showed that 26% of that group needed intensive care to recover. So it's not clear if that's the kind of percentage across the board, but if you don't have medical insurance, or if the hospital doesn't have enough ICU beds, then And without widespread testing happening here, it's also not possible to do what's called contact tracing, to see who's been exposed and needs to self-quarantine, and to identify clusters of infection. So I saw that in the Straits Times, that's Singapore's main newspaper, there's an infographic on the website showing all 266 cases as of today in the country, exactly where the cases come from, how they're connected to each other, and who has recovered. So the government has done a lot of long interviews and even looked at CCTV footage to try and track down every single case, and they've done that for almost all the cases. And this is a measure that the World Health Organization promotes because it saves lives. And with SARS, I think the country learned that a single infected person can spread the virus to up to like 100 people. So it's really important to know who's infected and where they are. right? And with early detection, about 40% of the cases in Singapore have recovered. 14 are in critical condition. Nobody has died of the virus so far. Schools are still open because it's very clear from the data that there's no infection there. And Mom, you forgot. I was in Singapore during the H1N1 epidemic. I was a school teacher at the time, and we did just as you described. Every student had their own thermometer. They took their temperature in the morning. I recorded it on a sheet. And if anyone had a fever, I called their parent to tell them to take the student to see a doctor. So for some reason unknown to me, cities with very big outbreaks in the US have already given up on contact tracing, saying that it's too resource intensive. And that's just really puzzling to me because South Korea has been tracking more than 8,000 cases. China is tracking 80,000 cases. So these are countries that have been through SARS and MERS, the Middle Eastern Respiratory Syndrome. So I'm not an expert, but I am guessing there is a use for this data. That, even if it doesn't inform the current situation, it helps you to prepare for the next one. So without extensive testing and contact tracing, the US seems to have a few strategies left. Travel bans, which are in place, lockdowns and curfews, which are happening in New York and New Jersey, and social distancing, right, that's now happening nationwide. And from what I've read in the news, it seems to me that social distancing was not driven by the federal government, but by leaders of private organizations and local governors. So while the federal government was spreading misinformation, scientists and physicians were the ones who sounded the alarm online. Many published independent reports, or I think they were sending out tweets about flattening the curve. And so introducing this idea that instead of having a big spike of cases in a short time, it's going to help the healthcare system and all of society if everyone practices social distancing and helps to spread out the cases over time. So what was remarkable to me was to see how in a matter of days, communities mobilized. CEOs told their staff to work from home. Universities moved their classes online. Large gatherings were postponed, and now, as we are all aware, restaurants, bars, schools are all closing down. So this is a really powerful form of compassion in action, where people are willing to make very drastic changes to their lifestyle in a short time, because we all want to reduce the number of people who will fall sick, to protect the elderly and vulnerable, and to protect healthcare workers. But this strategy comes at a high social and economic cost. And without reliable test data, I would say leaders don't really know how far to go. Because if you don't know the actual number of cases in the community, how will you know when it is safe to come out of a shutdown? What kinds of measures do you need to take as you ease out? Right? But right now, more importantly, who is dealing with the cost of social distancing on ordinary people? So a lot of communities are scrambling to find ways to take care of children who rely on schools for meals and daycare. Parents have to figure out how to work from home while caring for their kids. Or if they can't work from home, then they have to find someone to take care of their kids, and then they go to work worried about being exposed. Right? And then people can't visit their family members in nursing homes and prisons. Local business owners are suffering losses, and people are getting laid off. So this is really a time, I think, when communities have to band together and find new and creative ways to help each other. And just this morning, Venerable Sangye Kadro was telling us is it in Canada? People are using social media to share how they can help. It's called caremongering, finding out who needs care and who needs errands being run for them, and just people helping each other that way. So there's so many new and creative ways that we can find. And I will say at this point, I'm a bit tired of reading in the press articles like, all these countries are doing these other things, but they're Asian, they're small, I don't think we can replicate them. It's like, isn't it about saving life at this point, Can't we think out of the box? Instead of saying, well, it worked for them, let's not even try it. That to me is just moral laziness is what I'm gonna call it. Because what worries me now, and I think by now I worry a lot, is that there are 2 emergency room doctors from outbreak areas who have the virus and are in critical condition. So that suggests to me that the healthcare system in those areas is overwhelmed, such that healthcare workers don't have time to rest or are overexposed to the virus. Or they may not have enough personal protective equipment because there are so many cases. So last week I read that at the emergency room in Kirkland, Washington, where the outbreak began, Nurses had to use sanitary pads to buttress the padding in their helmets because they were out of supplies. So in an epidemic like this, all of us have to do whatever we can to help and support healthcare workers. And I think Singaporeans are very aware of this because when doctors and nurses started to die during SARS, the entire nation was heartbroken. So whatever little we can do helps. Washing our hands, not touching our faces, which is the hardest thing to do, and all of us just staying home right now will go a very long way to helping everyone around us. And finally, Mom and Dad, you already know this, but I have to say it again. Both of you turned 67 this year. This means you are at high risk of being in a critical condition or dying if you get infected. You are at high risk. So please, no cruise holidays, no getting on an airplane, no singing class, no qigong. Stay home, be good, wash your hands, and let young people go out and buy the groceries. Love, Tupten Damcho. And P.S., if you're wondering why a nun in retreat is reading so much news, I've been tracking the virus for a couple of weeks now to see if it's safe for venerable children and our other teachers to travel to teach in the spring. Obviously not.